Okay, so quickly now let's see how to remember, how to memorize the scoring from 0, 1, 2 and 4. So just imagine if a patient comes to you and you think that she's a pretty young female, okay? So automatically if she's a young female, she belongs to 0, okay? Less than 40 is 0, more than 40 is also just one risk. Let me tell you that. So age is not much affecting the scoring over here. So what actually matters? If she's a full-term pregnancy, she goes to a high-risk factor, that is 2. Okay, if it's a previous HMOL, usually ends up into GTN, but it's a very low-grade GTN most of the time because you were so careful with HMOL that you followed her up very beautifully. It's only after abortion and term pregnancy that you kind of, misdiagnose, ignore, neglect, patients are not treated properly, their bleeding again and again is like taken as, abhi to pregnancy hui hai, maybe her prolactin level is high, maybe that is, so they're ignored. So usually they're caught pretty late, which is when the third variable comes. That is, how long it has been since her last pregnancy. So if it has been just a couple of months, let's say 4 months or less, 4 to 6 months also, 0, 1, okay. But if it's gone beyond that, it's like 6 to 12 months or more than a year, they belong to high risk categories 2 and 4. So what I'm trying to tell you is that focus on the high risk. You'll automatically remember the low risk. That's the funda. So if you're talking about full-term pregnancy and more, becomes high risk. Age, not much effect, it does not have much effect. But if the antecedent pregnancy was long back, high risk. Beta HCG level, pre-treatment beta HCG level, it's very easy to remember. Now, one thing which is there given in the books is what they've done is they've put beta HCG as 10 to the power 3, 10 to the power 4, 10 to the 5. How many times in your reports do you really get this kind of beta HCG level that, it is 5.2 into 10 to the power 3? You get 5,236 or 50,544. This is how you get it, right? So what you have to remember for quick calculation is less than 1,000 is low risk. 1,000 to 10,000 is also low risk. But if it's above 10,000, 10,000 to 1 lakh or 1 lakh and above, automatically it becomes high risk 2 and 4. Correct? Now let's go on to the next slide. Largest tumor size. See, largest tumor size usually is not reported. If there is an ultrasound which shows, there is a growth seen and the growth is around 3 into 4 centimeters, then probably yes. But mostly the growth is not there. It's just hyperplastic endometrium or theca lutein or something like that. So this is questionable, but if it's more than 5 centimeters, that is why there is not much effect of this particular thing on high risk or whatever low risk, because that's usually not there in the reports. So 3 to 4 centimeters and 5 centimeters is lower risk only. Now let's go on to the site of meds. Like I told you, lung is the point at which the meds goes fast. So much so that in all other malignancies, lung meds is considered stage 4, but in this case it's considered stage 3. Stage 4 is rest of the meds. In that also, if it has gone to GI tract, liver or brain, then it is high risk. Even if it has gone to spleen or kidneys, it's low risk. So 0 and 1, low risk. Lung, spleen, kidneys, low risk. GI, liver, brain, high risk. And number of meds. Number of meds will always be reported. Number of meds are usually reported. 2 meds here, 3 meds there, 4 meds there, and you have to just combine it and see the risk assessment score. If it's more than 8, it's high risk. If it's more than 5 also, it's high risk. Okay, so that thing you should know. See, previous failed chemotherapy. Don't you think when a person comes to tell you, okay, I went through a chemotherapy, I had this, previous, let's say, low risk GTN, which is now, or probably had one episode of this GTN and I went through chemotherapy, and finally in the follow-up, or a low risk GTN, in the follow-up I was doing well, but suddenly there was a plateauing or sudden increase in beta HCG level. That means that one single drug therapy failed. So it's a chemotherapy. Failed chemotherapy automatically becomes high risk, but whether it is single drug agent or more than 2 drugs, it automatically becomes high risk. What I'm trying to tell you is that just remember this part. Automatically you will remember this part. Okay? It's not that difficult. It's very, very easy. If you just remember these 8 variables, 3 on the history alone and remaining 5 on the basis of diagnostic parameters, things will become pretty in your mind, and remember that 0, 1, 2 and 4. Remember this, remember just these two columns, and you automatically, these columns, the other columns will start to fill in. And just take this as a screenshot in your mind. Just have this picture, you know, inside your mind, and nothing can go wrong. Even in front of the examiners, remember to be strong, confident, at the same time respectable, because obviously the examiners do not remember as much as you remember. You are preparing for an exam, they have just come to examine you. So if you're answering confidently, maybe one value here and there they'll not pick, believe me, unless you are fumbling yourself. So that is one more trick which I wanted to give you today. So all the best for your exams. Stay in touch, be on my Telegram group, because I announce all my live classes there. Currently, vaginal hysterectomy workshop is going on. I'm taking live cases, some from my OT, some from other places, some borrowed from my friends, from their OT, and I'm teaching you hysterectomy step by step. So be sure that you are there in my Telegram group, because all the announcements are being made there and the classes are also being posted there. Okay, bye-bye.